Hi, and welcome to MediStop. In this video we will talk about an interesting topic, the infective endocarditis. We will answer 5 important questions. How does this infection happen? Which are the main microorganisms responsible for this disease? What are the signs and symptoms of infective endocarditis? What are the Duke criteria and how can we diagnose this illness? How can we treat infective endocarditis? Let's get started. Infective endocarditis is an infection that damages the inner lining of the cardiovascular structures, such as the valves, the cardiac chambers, a prosthetic valve, or other cardiac devices. How does this infection happen? The cardiac region affected is the endocardium, and there are 2 main reasons. The first reason is because of bacteremia. Basically, bacteremia refers to the presence of microorganisms into the blood flow. This usually happens when the patient is exposed to certain situations, when bacteria can pass over the natural barriers of the body and jump into the circulation. This is a consequence of either patient-related factors, such as bad hygiene or intravenous drug use, or it can be due to factors related to a medical procedure, for example, after a dental intervention or cardiovascular surgery. The second reason why the infective endocarditis occurs is because of a rupture of the endocardium or other cardiac tissue. This will make the heart vulnerable to infections. Alongside a damaged endocardium, a septal defect between 2 cardiac chambers will determine a turbulent blood flow inside the heart that eventually will have the same effect. These pathological events encourage the formation of platelet and fibrin deposits, which will help the microorganisms from the circulation to adhere, grow, and eventually determine an infection. These 2 reasons will promote the formation of so-called vegetations on the cardiac structures. Usually, the main structures involved are the mitral and the aortic valves, but if there is a former intravenous drug user, the right side of the heart is commonly affected. Which are the main microorganisms responsible for this disease? Recent studies have shown that the most encountered microorganism was the Staphylococcus aureus, especially for the patients with long-lasting catheters or former intravenous drug users. Next, we have the Streptococcus viridans, which is correlated to dental procedures or dental illnesses. Other microorganisms involved can be the Enterococcus, which can be found in patients with long hospitalization and urinary infections associated. What are the signs and symptoms of the infective endocarditis? First, we must inspect the patient's skin. We are looking for some typical hemorrhagic lesions on palms and soles. These signs are also known as Janeway lesions, and they are painless. On the other hand, the patient may also have some painful dots on his skin, usually on his fingerprints, these lesions being also known as ossular nodes. Other hand lesion could be splinter hemorrhages which are located on the nails of the patient. Infective endocarditis is also known for its ability to generate microemboli from the main site of the vegetation, and then send them into the circulation. These emboli can produce a series of signs such as hematuria, due to a renal involvement, petechia, or bruises on the skin of the patient, and splinter hemorrhages. One of the main symptoms that the patients experience is a high fever. This fever is special because it does not respond to normal antipyretic medication, and it lasts for an extended period, around 2 weeks. The patient may also experience fatigue and malaise. As far as the clinical examination is concerned, during the auscultation of the heart you could find a new murmur, or a changed one which might be a sign of valvular lesion. Alongside the auscultation, the patient can also have a fundoscopic examination, where we can find the Roth spots. New studies have shown that only 2% of people with bacterial endocarditis have these lesions on their retina. What are the Duke criteria, and how can we diagnose infective endocarditis? Duke criteria contains both clinical and paraclinical features that will help you set the diagnosis of infective endocarditis. There are 2 important major criteria and 4 minor criteria. As a rule of thumb, for the final diagnosis to be completed, the patient must have either 2 major criteria or 1 major criteria and 3 minor. Now, Let's talk about the major criteria. The first major criteria is based on the presence of some typical microorganisms in the blood, also known as a positive hemoculture. A typical microorganism must be found in at least 2 different hemocultures. The second major criteria says that on the echocardiography there must be signs of endocardium involvement, such as the presence of vegetations on the cardiac valves, or a valvular regurgitation. Nevertheless, as I told you, there are 4 minor criteria that you should know about. The patient predisposition. For instance, it is important if the patient has a heart condition that can promote the growth of a microorganism, or if he is a former intravenous drug user. Fever over 38 degrees, especially if it lasts for a long time. Signs of vascular involvement, related to an embolus. Immunological features, such as Osler nodes, Roth spots or glomerulonephritis. How can we treat infective endocarditis? First things first, antibiotics must not be administered before hemocultures, because it would impact the results. Well, the first step is to make an antibiogram alongside the hemoculture, in order to check the sensibility of the bacteria, so we can see what antibiotic we can use. Based on what type of bacteria we may find, the duration of the treatment is between 4 and 6 weeks. The treatment will be intravenous. In case of a staphylococcal infection, the treatment consists of vancomycin, or benzyl penicillin, depending on whether the staph is resistant or not to methicillin. In addition to this, we could also include gentamicin. Another possible etiology is a streptococcal infection, which will be treated with penicillin, and additionally we can use an aminoglycoside, like the gentamicin. As far as the enterococcal infection goes, it will be treated with ampicillin or amoxicillin, in association with gentamicin. As you can see, gentamicin is very popular among our treatment options. But be cautious when using gentamicin, since it is a nephrotoxic drug. Therefore, its residual concentration in the blood needs to be measured constantly in order to adjust the dosage as to prevent its toxic side effects. It must not be administered to patients with kidney disorders. With that being said, here we finish this episode. I hope you enjoyed it, and if you did, hit that subscribe button to never miss more content like this. If you are curious to find out more about other interesting illnesses on my channel, you should check my other videos about lung cancer and diverticular disease. You will find there all the information you need about these 2 topics. The links are in the description. Thank you for watching. See you in the next one.